When it comes to women's health, there's always been a rocky history. From hysteria to moving childbirth into hospitals, the care of women has been evolving throughout the years. Women's mental health has evolved with it.
So Sigmund Freud, of course, was pretty influential in our field and, had a particular way of looking at women and working with women. And over the years, as women just found more voice in becoming psychologists or social workers, then it's almost like the way we think about it changed. And so, for example, feminist therapy came along and said, you can look at what happens inside women, in terms of our own thoughts and feelings, but it's really important to put that in like a social context. And so let's look at things like gender socialization or the pressures women feel to be a good mother, for example. Like it's not okay to think about not being a mother. Or my area of study in graduate school around women's career development, is really claiming that work is an important thing for women in terms of just sense of self and agency. I mean, women have been working forever in different contexts.
Yet, despite the evolution in women's health, there is still a negativity that surrounds women.
I think as women, because of our insecurities that we've been raised from media influences, from how we're supposed to see body image, from how we see sex, it's very easy and simple to criticize or to hurt other women or to bring them down because of our insecurities. And so what we can do as women is to, one, become more conscious of where words of hate or saying, what a slut, what a whore, or she's so ugly, she's so fat, where do those come from?
But are men blameless? Do they even have the same kind of challenges that women have with their mental health?
I think there may be different challenges. I think men tend to have a certain level of privilege in society, which is well known. Things like pay and of course in many professions you see a lot more men in leadership than women. So I think the experiences are different and the advantages might be different. But men do face some unique challenges and pressures to be masculine. We see more and more body image issues with men as time goes by, needing to be either muscular or slimmer, looking different ways, being but I guess the point would be men also feel pressure to fit into certain roles.
So with both men and women criticizing them, who are women trying to actually impress?
I think it actually can be both. I mean, I think because women, again, more kind of generally tend to be very relationship oriented, I think it can very much play out in someone's romantic relationship. And everybody sees the images of women in movies and TVs, and it's hard not to take that in and think I need to look like that, and that somehow my worth is defined by how I look. So I think women are certainly susceptible to that. But for me, it goes deeper because I do think it also connects just to how I feel about myself and my self-worth and kind of the value that I have.
How are women dealing with the negativity that surrounds them?
One of the things we think about is for depression, for example. Typically women, and again, this isn't the case for all women, but for lots of women, that does get turned inward. So I think that it's something that I've done, and I start to feel worse about myself, and it's just more of an internal focus, where men may be more likely to get angry and act out their kind of depression. And so it just is the same kind of thing, but it looks different. And interestingly, that maps on pretty well to gender roles, too.
While there's no easy way in handling the difficulty that is women's health, education seems to be the key, even if it's a little awkward.
And then I've explained to friends what a clitoris is. It's so sad. Women don't know their own anatomy because masturbation and female genitalia is so taboo, because as virgins, or what we're supposed to be, we're not supposed to know that stuff. Not until the man says so.